Hi everybody, salutations, and thank you for watching episode 73 of DiabeticRadio.com. I have a story for you guys today. I really wasn't sure if I wanted to talk about this situation on video, but the more I thought about it, the more I realized not just how disenchanted I was about the whole experience, but these things really, all patients really need to know about this. I was having some trouble really trying to figure out what I wanted to call this video, but after a while I realized that the subject matter really boiled down to, that I want to talk about, boils down to Dr. Etiquette. Thus became the title of the new video. I went to my favorite optical store to get my pair of new glasses and to schedule my examination. As always, the sales staff are consistently phenomenal. I just love absolutely every one of those staff members at LensCraft. They are just, there's no other word that I can think of other than phenomenal. And the energy there is just like no other place, and I'm always greeted. It's just, they're just like phenomenal. I can't think of any other word, and I absolutely trust their opinions when it comes to eyewear. However, when I visited the store again to get my eye examination, it was a whole different matter. I followed the assistant tech to a room to get images taken of behind my eye. She had some trouble, and she called the doctor for assistance. Unfortunately, the doctor couldn't get those images either because my pupils were too small. I never realized this, that they were that small. And I'm thinking maybe next time I should try to remember this and ask the doctor to dilate my eyes, beforehand. I'm not sure if that would make any difference. I don't know. I guess it's a question worth asking next time. This particular doctor I never met before. The doctor called me in her office, and you know how sometimes people talk to you in a certain way and you don't know how to process it until a little while later? Well, this is one of those moments. And when I sat down, and mind you, this doctor doesn't have any extensive knowledge of my medical history, she immediately commented on that I have some bags under my eyes. I was thinking, I think that's what she said, and that indicated high levels of cholesterol. Not that I'm tired, not that I needed to sleep. She's just like, that indicates high cholesterol. I explained to her that my cholesterol is pretty much under control. She looks at my chart and stated, but you're taking simvastatin, right? That's to control the blood sugar, right? Do you know what blood sugar does to the eyes and blah 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 blah? And I'm saying to myself, if I tell you my cholesterol is under control, the fact that you see the drug, in my chart would indicate in my mind this is one of the methods I use to control my cholesterol. I got to stop here for a minute, and I gotta say, see, I think what's happening here is, people hear diabetes and they see that the diabetic is overweight. People always feel compelled to make these bold assumptions that it's automatically because of the patient's eating habits. I'm going to school some of you and remind doctors that cholesterol is not exclusively a diabetic issue. Yes, although many diabetics, particularly type 2 and LADA, have higher cholesterol, but link to diabetes does not mean the cause of diabetes. It is not an exclusive diabetic issue or type 2 issue. For some of us, our bodies simply make too much cholesterol. It's not just about food. And sometimes you just need that medication. Get it? Cholesterol has its own genetic factors in addition to age, etc., etc. It's not always because we like to eat like pigs and eat fried food for breakfast, eat fried food for lunch, and eat fried food for dinner. Like diabetes, cholesterol is complex, and I think that it's safe to say, to speak for many diabetics when I say, stop painting all diabetics with the same brush. Thank you. Oh, she also asked about my A1C. I told her, it was 6, and it was like, she had nothing else, to say about that. But, she also found, she said, she like verbally beat me up because, I told her I didn't see the eye doctor for a while, and, blah, 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 blah. And she was like, I'm thinking to myself, real world, sometimes you just can't. You don't do it on purpose, but sometimes, you go through things in your life for whatever reason, you just can't do it, period. A patient should not have to defend themselves after comments like that, especially by their doctor. You know what I mean? Thinking back, I never met this doctor before in my life, at least, that I can remember. And it was almost like, the same kind of energy that someone has when they are trying to spark a debate. Now, I hope I don't sound egotistical or anything, but I know that I've gotten very popular ever since the issue with this, a-hole I'm going through, just making me popular all over the place. And I have noticed that doctors tend to treat me very differently now. It was like some doctors are very cool and make sure their demeanor, they respect me, and then other doctors, it just seems like they're kind of combative. She was making me know that she was a doctor and she knows what she's talking about and blah 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 blah. Like I said before, there are two sides to health. There is your book knowledge, and then there's your life experiences, and it's very different when you are the patient. Then to top it off, I had to come back for the dilation. I left there feeling so subconscious after she was saying all of that. I was just so dumbfounded. Now, when I went back to see the second doctor, I got a whole totally different experience. Not only was the second doctor awesomely cool and sensitive to me as a patient. She gave me the great news that my eyes are still strong and are in good health. And not only that, she told me that she didn't see any deposits inside my eyes that would indicate, any damage due to high cholesterol, or even indicate high cholesterol, or anything like that in my eyes. The first doctor didn't even tell me about my eye pressure, whether that was good or not. It just felt like she was so busy, being in combative mode. I don't know, maybe the first doctor, had a patient that really, put her in a bad mood or whatever, I don't know. But I would really like to express to any doctors who may be watching, or any nurses for that matter, be very mindful of how you treat your patients. It really can make a difference on our self-esteem and how we manage our diabetes. Absolutely do not make any snappy judgments about people, especially when it comes to patients, unless you personally have a long medical relationship with that individual patient. You understand? Sometimes it seems like there's a separation between patients. It's like almost, sometimes I feel like sometimes, we're not human. Doctors and nurses, please take heed to what I'm telling you. It really makes a difference. This is what makes the difference between a health professional that has a career and a health professional who has a job. Do not use statistics to profile your patients, because statistics does not tell the whole story of an individual patient. You know what I'm saying? Do not profile us, because, unless you know that person, you don't know shit. Sorry to be blunt, but anyway, I hope this video helps. I mean, I almost didn't do it, but I know I can't be the only one who's gone through it. I know a lot of us go through it all the time. And again, unfortunately, I have to say, it's an experience that's so common that we have, and we need to really speak up about this, and I think one of the problems, one of the many problems, I think there's so much information about diabetes in particular, that it's almost as though doctors, or just people in general, just don't have the experience or know how when to invoke that information, or when that information is applied. Information is just that, information. Information should not be used to stereotype people or to make assumptions about people, because you don't know. You absolutely don't know. And diabetics, I beg of you, start reading so that you can learn more about diabetes, and stop some of the people in their tracks when they do some of this stuff. And a lot of diabetics who don't know, they listen to all of this stuff, they internalize it, they make you have low self-esteem as a result of it, or make you question yourself or your ability to take care of yourself, because of someone's issues about how they think or feel about all diabetics. We are not every diabetic. We are distinct individuals who happen to be diabetic, and each one of us has our own separate issues, circumstances, and conditions. I didn't mean to rant, but I'm gonna leave it at that. I hope this video helps. I love you guys. Thank you so much for listening. Thank you so much for supporting me. I mean that from the bottom of my heart. I love you. Take care. Bye.